Goodbye A cup, welcome C cup. 가슴에 자신감을 심어드리는 라이안성형외과 원장 최상문입니다. 이번 시간에는 세계적인 권위자 찰스 랭퀴스트 선생님을 모시고 가슴 성형에 대한 이야기를 나누려고 합니다. Good morning, Dr. Charles 랭퀴스트. Thank you for coming here.
My pleasure.
A lot of viewers are interested of you. Can you give a short introduction to the viewers?
Yeah, hello everyone. I'm Charles Ringquist from Stockholm, Sweden. I'm a plastic surgeon and I've been in private practice close to 30 years, and it's a true pleasure being here in Korea, sharing my experience and knowledge with my colleagues that I've met for many, many years. Been coming to Korea, performing live surgeries close to 15 years now, and this is just another beautiful journey. Thank you for having me.
It's been 6 years, so after COVID-19 and during COVID-19, how have you been?
No, it's been great. You know, I run this facility back home in Stockholm, and it's a 24-bed facility with 3 ORs. And in one sense, we've been fortunate because Sweden hasn't had the restrictions. So we didn't have any major lockdowns, and it's been a democracy. That's how I see it. With my reputation, I had patients coming from all over the world, including Southeast Asia, actually, to have the problem solved because they didn't have the possibility to have surgery in their countries. I do a lot of secondary breast surgery. So,
wow.
So for me, there's a pandemic, and for my staff, we've been having quite a good journey.
Well, I saw a lot of photos of your clinic and some of our video clips. It was like the view and the atmosphere was so amazing. Can you give us a little bit more explanation about your clinic, the location?
Yeah, so when I went into private practice about 30 years ago, I had this vision. I want to create something that's more like a spa, more like a retreat than a hospital. So it's situated about 50 minutes away from Stockholm City in the archipelago, and my hospital is on an island. So the hospital overlooks the sea. It's an old building, and the beautiful thing with this is that if you're relaxed and you have a consultation with a surgeon, you get so much more information because you're less nervous, so
Yes.
the input is so much better. And when they have surgery in this area, it's clean air, it's not polluted, and you're able to wake up because we have overnight stays, so they stay for a couple of days. Of course, the healing process is even better because your soul feels better. So the whole environment, the ambience is very peaceful. And patients like this, and it's very exotic. For a lot of these patients that come from abroad, they find it magical.
So I think after the surgery, people feel more relief, relaxed, and comfortable. So,
Oh, absolutely.
Yeah.
And the thing is, I've got the clinic with my staff and they speak several languages, so no one needs to feel that they're intimidated, that they can't speak or express their emotions or fears or pain. So I've got staff taking care of that. But then also I've got a skincare center. So sometimes they come with relatives or they stay for a longer time. So we can have skincare treatments, and we come to the rooms and have skincare treatments. So it's an all-over experience. So it's not medical tourism the way it's known normally. It's more patients who want a special type of treatment service, not because it's cheaper, but because the whole experience is different. I've been trying to create something that's more holistic, not just the outer body, inner health, outer beauty, so to call. So we talk about food, nutritional supplements, we talk about everything.
Wow. So it's like total treatment, not only just the body, the whole mental status and their feeling. Wow. Amazing.
Everything surrounding, and I think that's our responsibility as surgeons. We're very good at cutting, and we take pride in that, but the human being is so much more than just feeling I need to do my nose or my breast. It's also emotionally very important. So I put a lot of time and effort in creating that feeling and helping them long term. It's a different approach. It works for me and my staff, and I think that's part of the future also for us as aesthetic plastic surgeons.
That is very cool. That is very awesome. I love your concept. I love your philosophy, how you treat your patients. Not only patients, you think as a human being, as an approach as a real kind of humankind.
That's why we became doctors.
Yeah.
I mean, to take care of people. It's like I tell junior surgeons, remember, your responsibility doesn't end with the last stitch. That's when you take responsibility for that patient for the rest of her life. If you put an implant into the patient's body, you have a responsibility for the rest of her life.
Yeah, we have to it's our burden and our legacy.
Our responsibility. And that's why we have these long follow-up programs. You know, we follow our patients at least over 10 years with ultrasound, and we've got our guarantee programs, and that's taking responsibility. If breast augmentation was free and absolutely safe, most women most likely would like to have a little bit bigger breasts.